Okay, so we're going to begin our cranial nerve assessment, and this is just to observe different parts of your face, your mouth, inside your mouth, your lips, your neck, your shoulders, just to make sure that everything's working in order, and most importantly, that your cranial nerves are working. So first, I'm going to have you clench your teeth. Watch me like this, strong as you can. And while you do that, I'm going to touch parts of your face here and here. Okay, so go ahead and do that. Okay, all right, good. Okay, now I'm going to have you open your mouth. Okay, go ahead and close your mouth. Gonna have you do that again, but I'm going to push against your chin here, okay? And you go ahead and open your mouth. Ready? All right, go ahead and close your mouth. Okay, now I'm going to have you open your mouth and move your jaw from side to side. Move your jaw from side to side. Okay, good. All right, now go ahead and pretend to chew. Okay, you can stop. Now I'm going to test the sensation of your face and your cheeks and your lips, just different parts, and I just want you to tell me if you can feel when I put something on your face. Okay, go ahead and close your eyes. Okay, ready? Let me know if you can feel where I touch.
I can feel it.
Okay.
I can feel it. I can feel it.
Okay.
I can feel it. I can feel it.
Okay. Now I'm gonna have you do it again, but with a different type of texture. Okay, so go ahead and close your eyes.
I can feel it.
Okay.
I can feel it. I can feel it. I can feel it. I can feel it.
Okay, good. Thank you. All right. Now we're gonna move on. Now I want you to just look straight at me. I'm just gonna look at your face. If you could actually remove your glasses really quickly. Okay, good. Thank you. I'm just gonna look, make sure that everything's symmetrical. Go ahead and keep looking straight at me. Okay, good. Thank you. Okay, now I'm gonna ask you to make an angry face. Yeah. Okay, go ahead and stop. Now I'd like you to remove your glasses again. Okay, I'm gonna have you close your eyes really tightly, and I'm gonna try to open them, but don't let me open them, okay? Close them tightly. All right, other side. All right, you can stop. Okay, with your lips closed, go ahead and make a smile. Okay, good. You can open your mouth and smile. Let me see your teeth. All right, good. Okay, now I'd like you to pucker your lips like you're blowing a kiss. Okay, stop. Now I'd like you to puff your cheeks like a blowfish with air. Good, okay. Now I'd like you to say pa.
Pa.
Let's try it one more time. Pa. Okay, good. Okay, so now I'm gonna do a little taste test on the front part of your tongue. We're just gonna see if you can taste a few things, okay? Just 2 things. Okay, so I'm gonna have you close your eyes and open your mouth wide and then just stick out your tongue. Yeah, like that, okay. Okay, and just tell me what you taste. Ready? Here's the first one.
Sweet.
Good, okay. Okay, now let's do the next one. Ready? Go ahead and close your eyes again. Here's the next one. Oh. How does that
Sour.
taste? Sour. A little too sour, huh? All right. Okay, let's move on. Okay, so now I'm gonna have you say ah for about like 7 seconds while I just look inside to check that your palatal area is symmetrical and that it elevates, okay? So go ahead and open your mouth. Say ah for like 7 seconds.
Ah.
Good, okay, thank you. Okay, and now I'm gonna do another taste test, but now it's gonna be on kind of like the more back part of your tongue. So I'm gonna have you close your eyes, open your mouth wide again, and stick out your tongue a little more so I can reach the farther back into the tongue, okay? All right, okay, here goes the first one. Okay, all right, open wide. Okay, what does that taste like?
Shower.
Alright, ready for the next one? Okay, open wide. Okay. What does that taste like?
Sweet.
Okay. Alright. Okay, now I'm gonna test your gag reflex. So this is where I'm gonna use this to touch the back part of your mouth to see if you have your gag reflex. You know, like when you're eating a lollipop or you're brushing your teeth and you kind of move it back to the far back of, you move it back to your mouth and then you kind of go like, ugh, like that. That's your gag reflex. So I just want to make sure that that's there. So I want you to open wide. Open your mouth wide. Go ahead and stick out your tongue. Okay, ready? Oh, there it is. All right. Okay. Okay, so the next one, I just want to listen to your voice quality. So I'm going to have you say ah for as long as you can. Go ahead. All right. Okay. Now I would like you to cough. Go ahead and make like a hard cough, like you have something in your mouth. Right. Okay, and now we're just gonna have like a small conversation just so I can keep just listening to your voice quality, okay? So did you watch The Bad Batch yesterday?
Yeah.
What was your favorite part?
The one where the two people from the Clone Wars came out.
Yeah, they were pretty cool. I also thought that Wrecker, I almost thought that he was already gonna turn to the bad side because remember, like his head.
Yeah.
Yeah. Did you have another favorite part?
And when Omega uses the bow.
Oh yeah, that is pretty cool. All right, so good. Thank you. All right, now we're gonna do our next part. I want you to have a sip of water and then just go ahead and swallow that. All right. Now I'm gonna have you turn your head from side to side. So go ahead and look straight ahead, and now turn your head to the right, and then back forward. Turn your head to the left, and look straight ahead again. Okay, good. So now I'm gonna push against your head as you turn your head from right and left. I'm gonna put my hand here against your face, and you just push against my hand. Okay. Okay. Turn to the right. Okay. Turn to the left. Against it. All right. Okay. Now I'm going to have you shrug your shoulders. Okay, and I'm going to have you do that again, and I'm going to push against it. I'm going to put some resistance, and you push against my hands. Okay. All right. Good. Okay, just a few more, and we are almost done. Now I want you to open your mouth and stick out your tongue. Just gonna look inside. Okay, stick out your tongue. Now keep your mouth open and stick it back in. Okay, so now that I have, close your mouth. Okay, so in our mouth, we have, on the roof of our mouth, we have two parts to the palate. We have a hard palate, which is like the bony area. Do you feel that? And half of your mouth, your tongue. Okay, and then if you slide your tongue back, you have the soft palate. Do you feel the softer side? Go ahead and open your mouth and just kind of move your tongue back. Do you feel the soft part? Okay, so that's your soft palate. So what I want you to do is when you open your mouth, I want the back part of your tongue, try to touch that part, the soft palate, with your tongue, with the back part of your tongue, okay? So open your mouth. Okay, and try, yes, like that. All right, good, thank you. All right, now I'm gonna use this tongue depressor to push against your tongue on different parts, and I just want you to push back against it, okay? So go ahead and open your mouth. Mouth, stick out your tongue, and I'm going to push against it on the tip and on the sides, and you just push against this too, okay? Ready? Okay. Okay, stick out your tongue again. Right, stick out your tongue again. Right, good. Okay, now I want you to do the same thing, but against your cheek. So I'm going to put my fingers against your cheek and just push against it with your tongue, okay? Okay, this side. Good. Okay. All right, and that concludes our exam. Thank you for participating.